Thank you, David, for your patience. Thank you for being with us.
That's
And
okay.
David
Don't
is
worry
no
about it.
stranger to any of us.
Okay.
He's the backbone in terms of science and technology, and I'm going to turn the meeting over to him. Thank you, David.
Well, thank you. How's it? I hope everyone's doing okay tonight. So I'm sort of running around right now, and I'm a little disorganized with all apologies, but I'm trying to catch up. But Sanaz has asked me to join the meeting tonight and sort of go through a number of things. The one thing I'm trying to uh, really understand better with our products and try and in terms of bringing information to people. Uh, I'm trying to see exactly how things really work and why they work. And I thought that'd be sort of the subject tonight as to why our products work the way they do work. I'm taking from strictly a background in product development and science and the rationale behind it. And I'm going to do it on certain levels, and I'm going to talk a bit about all the products so that we have an idea. And even so, like we use terms like, we've got an antioxidant and anti-inflammatory. We do all, and yes, these are really important. But the question really is, how does it really work in the body? And I don't think it's easily answered with a lot of things. And I started looking at this, and uh, for example, and I'll start out with this one. Uh, in Divine, we have this ingredient that's really interesting. It's called the French maritime pine bark extract. A lot of words there. And I think that everyone will understand, and they'll tell you that it's got incredible properties, helps increase blood flow, great for cardiovascular disease. It is an anti-inflammatory antioxidant. It does all these wonderful things, and it's a very important ingredient, and it's been proven scientifically. And it goes on and on. And I kept wondering for the longest time because I've known about this ingredient for a while, and I didn't was never really sure about its properties and how does it really work, when I describe it to people, I say, well, it's an antioxidant, it's anti-inflammatory, increases blood flow, it's great for sexual dysfunction in men. Uh, the question comes back really, silently, is why? And it's really interesting. And I think, maybe it's not of interest to you, maybe to some of you. I think for the Asian community, because they always ask all these questions. So I thought I'd figure this out. And I discovered how it really works. And I thought this is fascinating, is that this pine bark extract reacts with this enzyme in the body. The enzyme in the body is called endothelial nitric oxide synthase. And when that occurs, it reacts with L-arginine, which is an amino acid, causing it to create nitric oxide, which increases, like it acts like nitric oxide in a safe manner and opens up our blood vessels. And that's why we get all these benefits from it. It's very safe, but we get all these benefits from this in terms of increased blood flow. That's why men's sexual dysfunction is improved, because if a man has a bit of plaque in the system, it will cause ED. And we're always trying, we look at that, some of the products as to how it will help men in terms of their quality of life. And that's one thing to know. As a result, there's many other benefits, the cardiovascular benefits, by using this pine bark extract. And so we have this in Divine. So I thought it was really important. And I took a look at glutathione and what is glutathione made of. And, glutamic acid, glycine, and cysteine. And these three amino acids are such that these are building blocks for things, and this is why it helps repair the body. And that's why all this is very important in terms of giving our body the tools to make sure that it is can maintain itself and repair itself. And that's just some of the things that occur. Now we start taking a look at things like Fountain of Life. So what does Fountain of Life have? Fountain of Life has the extract, and we've talked about this many times, and if you're new to this, uh, this evening, this Crossfire, we will talk about, we've talked about Fountain of Life for past 5, 6 years. And what it contains is the extract from the Norwegian spruce that grows in northern Finland. Nowhere else. The Norwegian spruce grows all over the world, but this particular tree comes from northern Finland. And why is that? Because it's in a very harsh environment. The trees there have learned to adapt. And when they checked that tree, they discovered that it was virtually disease-free and pestilence-free. And the reason it's so effective is that it had an incredibly high lignan count, lignan, which is an antioxidant found in the plant cell walls. So the scientists took this and they started experimenting with it. They discovered that it had a great source of lignans, and studies have shown that societies that had a high lignan diet had less incidence of cancer and cardiovascular diseases, all related. And as they studied this lignin, the 7-HMR lignin that's particular to this Norwegian spruce, they discovered a lot of great things. And they're continuing to learn more, that this converts to a thing called enterolactone in our system. Compared to flaxseed converts to enterodiol, and then it converts to enterolactone. So this converts to the very powerful, um, it's called a human lignin or mammalian lignin called enterolactone. And enterolactone is anti-cancer and anti-metastatic properties along with everything else. And so why does it work so well? Because enterolactone reduces chronic inflammation in the body. It reduces the oxidative stress we face, and oxidative stress is a gateway to so many different issues. And that's why, okay, if you look at the Facebook page, it's a little odd, I think, to a newcomer because it sounds like we're making all these extraordinary claims, but really we're making one claim, in that it's an effective antioxidant and it reduces chronic inflammation in the body. And chronic inflammation, when I don't know, when it's unguarded and when it's untreated, it leads to so many different issues, from cardiovascular disease. It goes to diabetes type 2. It can lead to dementia. It can lead to so many other different issues, including cancer, of course. And the whole thing with Fountain of Life is that it reduces that opportunity. It is not a panacea and it's not a cure-all. And I want to really stress that our products do not cure any disease. We can't make that claim because it's not fair and it's not true. But what we can say, though, is that people that are taking in high levels of, the French pine bark extract, or glutathione, or the Fountain Life extract, the lignans, is that they've benefited from that. Their quality of life has improved. And that is not an untrue statement. It's just that we cannot make curative claims. It'd be impossible to do so. And you don't want to make claims like that because it's not true, or it's not fair. So, and you don't have to make these claims. But there are many people that are using things like Fountain Life, and they've learned that their disease is not going away, but they've learned that they can live with this and have a quality of life still. And it's very, very important. And as we've gone through that, and if you go through the Facebook page, you'll see tons of testimonials that are really important to show how powerful this product really is. And you're going to start seeing more in areas like Divine, because it does bring forward some interesting elements that are so important to us. And anytime that we're devoid of a nutrient, we should be supplementing it. Okay, so those who have a fast lifestyle, and when I say a fast lifestyle, you're always on the go, you're not eating properly all the time, you should be supplementing it with the right supplement. Now, Divine is interesting because it combines with food, so you should uh, take Divine with food, whereas Fountain of Life is a food upon itself, so you don't have to do so. So there are many ways of approaching your health, but the thing is that what you should do is chronicle it. You should take a look and decide what is best for you as you're starting to move forward. Now, as we introduce the collagen product, Arctic Vita, I think again there's an opportunity to really impact certain areas like joint health, the appearance of our skin. As we grow older, our skin loses collagen, our joints lose collagen, we get creaky. There's lots of things that aren't pleasant that occurs as we grow older, and we're able to supplement that with a collagen product. And Arctic Vita does provide us with an incredibly positive and powerful uh, collagen source. It's marine collagen. And so as you start breaking it down, it's a very clean, very bioavailable type of collagen. And what I mean by bioavailable is that our bodies can utilize it. There's a lot of products out there that have low bioavailability. And what that means is that it could be there, but our bodies aren't absorbing it, it's not using it. So it's one thing that they always talk about in the pharmaceutical industry is bioavailability. And some of the generic brands of pharmaceuticals just don't have the same bioavailability as the brand names out there, so they claim, and I've heard that one. And so if you don't have a bioavailable product, it's not going to work that effectively. Okay, so I want people to sort of understand the way we're going on this and how we can really help impact people's lives. And as we're moving through this tonight, if there's any questions, I'd like to be able to address them as we start moving forward. Okay. So if you could put in the QA box, we could do that. I don't see anything so far. Okay. So when we start taking a look at our products and the balance of our products, you're going to start seeing exactly uh, the science behind it. And the importance is to understand that science so that you can relay the message to, prospective members, prospective clients as to why it's effective and why it works well. The one ingredient we have in a lot of our topical products is now microsilver. And microsilver is interesting. It's something that I was introduced to at a research center at the University of Toronto with the president and the vice president of the Microsilver company. And we had lunch together there, and this was quite a few years ago. And there are certain things that we really did dive into. And the first topic we came across, of course, was what is the difference between microsilver, nanosilver, silver water, and colloidal silver? And that was one of the first things that we discussed. And people should realize that there's a marked difference between them, and that nanosilver, colloidal silver, and silver water, and I group them all together, are ionized silver that can be absorbed in the body, but it can lead to different issues. One of the issues very clearly is argyria, and argyria is the permanent graying of the skin because it's absorbed at the cellular level. And so you have to be very aware of that because colloidal silver and nanosilver and silver water is sold in health food stores. I'm not sure why. I can find it here in Canada quite easily. I'm not sure in your area of the world whether it's possible, but I can find it here. And if it's available here, I'm going to guess it's available in other areas. And I'm not sure, as strict as Health Canada is on so many things, why they allow silver, nanosilver as something that's an ingestible, because I do not believe that it is the safest product in the world. It can cause problems with the kidneys. That is well documented, yet I can go to the store, after this call, I could go to the store and find it. So I think we have to be careful of that. The one thing to know is that microsilver, number one, is safe. So because it's in our toothpaste, in our mouthwash, and our mouth spray, let's be real clear that it's safe. And if you should accidentally ingest it, nothing will happen. And the studies have shown, and we do have studies shown that uh, any absorption of, or any ingestion, not absorption, sorry, ingestion of microsilver is excreted by the body. So in other words, there's no absorption. It doesn't go through the microvilli of our small intestine. In fact, it is expelled by our body, which is a really good sign because we do not want it to be absorbed at the cellular level. Now, nanosilver, unfortunately, and silver water and colloidal silver can be absorbed, and that's the problem with it. But nanosilver and colloidal silver do have a purpose out there, and they do make good hard surface cleansing agents. I've seen it, I've seen the studies, and I want to be objective about it. So that it does work as a cleaner, but as far as its ability to be ingested, I don't really think that's the type of thing we want to uh, ever do. So if someone says, "Well, I'm using colloidal silver, or I'm using silver water, or nano silver in terms of a drink," I really would wish them all the best, but I would caution them as to what you know. I'd be very careful, and I would tell them that. Okay,
Yeah.
so it says, does Fountain of Life work better with Divine? Are they supposed to be, hold it, work better with Divine, or are they supposed to be given together? Okay, which is probably the same thing. Okay, um, I guess I mean, can they use separately? It depends on the diet, number one. But there's a one-two punch here. When you take a look, excuse me, I got a bit of a cold. There is a bit of a one-two punch with this. That Fountain of Life can work well with they work. They're separate in terms of the mechanisms of action because Fountain of Life replaces the lignans no longer in our diet. So I'm going to guess that you're not taking, or anyone on this call, or anyone that we really know has a good lignan diet. Unless they're taking Fountain of Life. And the reason I say that, the average person in the world takes 1 milligram of lignans a day, and we're supposed to take 50 to 100 times that. Okay. So let's clear that up. So that's why, number one, this is an important element in your diet because you have to replace that for the benefits of lignans in your diet. And lignans have shown to help societies with their health issues, and it's reduced serious health issues if they have it there. Divine, on the other hand, is a different product. It contains things like glutathione. The French pine bark extract uses zinc, vitamin D, vitamin C. All these things are part of that. And, if our diets are sort of poor, we should really take a good hard look at that and combine that with food. So you're supposed to take Divine with food. And I would suggest using Divine if you have a rather, depending on your diet itself, but my guesses are this, is that you're not going to be, uh, as you are growing older, not going to be efficient in terms of having a source of glutathione. Glutathione, unfortunately, as we grow older, we stop producing it as effectively. That's one of the downfalls. And glutathione is known as the master antioxidant. And if we don't supplement it, it's going to cause issues. So supplementation of glutathione is really important. Having zinc in our diet is very important. We don't produce zinc at all, so we should have a good, solid source of zinc. The bark extract that I just talked about can help us in so many ways, and it has that ability to help our blood flow in our body, especially as you grow older. We're looking at a number of different factors as we move forward. So I would suggest taking it together. Okay, I would suggest taking it together, but at the same time, there's this thing, and I remember I was working with a European doctor, and in Europe they got some really interesting types of medicine there, and they've got more or less a level of holistic type medicines. And she was telling me all about this, and she's a brilliant, brilliant doctor, and she described what they call biofeedback. And simple term, something that we talk about a lot in science, biofeedback. And I would ask you to look or even chronicle your own journey and use biofeedback. How do you feel when you're taking? We suggest, so much FOL, 30 drops a day, 3 capsules a day of Divine. Biofeedback is really important. Maybe you need 4 capsules of Divine and a little bit more Fount of Life to feel any different or get some benefits. So biofeedback, decide exactly where it fits within the scope of your own health routine. Okay, so approach it that way, and you're going to start seeing changes for the better, worse, but adjust it accordingly. Okay, and your diets might change. That's one thing. Your diets might change, your routines might change, and you might need, again, just keep chronicling it and keep having a very objective review of what you're doing because your health is very important. The second thing is what advice would you give a chronic disease patient concerning Divine? Should they take it for 3 months and take a break or take it continuously? I'm not sure why you'd ever take a break on things. If it's a chronic disease patient, then a chronic disease patient, that's a very broad subject. Again, biofeedback, you got to use that as a monitor. But I would take Divine because obviously they're missing something in their diets, and I would combine it with food. Okay. So, because it is a vitamin, it does contain vitamins, you have to combine it with food, or else it's not doing anything. Should I take it for three? Should they take it for 3 months? Well, I would take it for at least 3 months. Same with Fountain of Life. I would take it for at least 3 months to get some benefit from it. And no, I would not take it a break. I would never take a break because obviously you got to ask yourself, am I seeing any changes in my health? Am I seeing any changes in my quality of life and the way I feel? And if there are, then continue it. If not, let's reevaluate. But this is something that you got to keep doing. The other thing is never ignore your doctor. Okay, really important. Have a good discussion with your doctor. Your doctor, he wants to know what you're doing in terms of your diet, your health. They're very interested. So, and they're not going to say, no, stop taking it or whatever. They might question it though. So, Divine is pretty straightforward. They would understand, I think, all elements of Divine. If you show them the bottle, they would understand it. With Fountain of Life, I'll be honest and say that many doctors will say, never heard of it. I don't understand what this is. All you have to do is tell them that this provides a source of enterolactone in the body, very similar to that of flaxseed, except it's more powerful. And we do have proof of that. That's exactly its mode of action. So I would position it that way. So just say this is just like flaxseed, and they'll understand it. Okay. So someone has just asked me, do you take it with food? I say take it with food. Yes. I'm not saying take it with food. I'm saying that the experts tell you. I'm not. This is not my opinion. This is what I know. I'm referring back to my university days with Dr. Brightsey. I don't think she's around on this call, but she taught me. And if I want to have one good meal a day, can I take all three? Well, you are supposed to take 3 capsules, so take it, yeah, with that one meal, of course.
David,
So,
I have a question.
yeah,
I have a question.
yes,
If you're dealing with a rheumatoid arthritis patient
yeah, uh-huh.
and their autoimmune system is off, their autoimmune system, so they're taking on an autoimmune suppressant. Um, what sort of dietary supplement, because we're talking about Fountain of Life and we're talking about divine here. What
Mhm.
sort of dietary supplementation would with our increased dietary supplement in Fountain of Life, would it have an effect on the autoimmune drug? Because you're putting more lignards in there too.
Well,
Just your
okay.
take on that.
Anytime you're on medication, you have to discuss that with the doctor. Okay,
Right,
there's too many drugs on the market now, and I don't know what they're taking. The other thing to note is that people that are usually on drug therapy aren't just taking one drug, they might be taking multiple drugs.
right,
And so I don't want to say, oh, it's okay, assuming it's one thing when they're taking other things that could be affected. Now, the majority of medications are not going to be affected by Divine or Fountain of Life. However,
right.
having said that, things can be affected. Like honestly, if it's an autoimmune disorder, I don't know of any contraindications to it, but I'm not up to date on every drug out
Okay,
there. And so
fair
just
enough.
discuss it with a doctor and just ask them, is there any reason I shouldn't supplement my diet? Ask them because you,
Fantastic.
you want to make sure that they would know because drugs change on a regular basis. There's always a new drug out there. There's something new. There's something more powerful. There's something that gives better results and all that. And it's a constant cycle that goes on with these drug companies, and to keep up with that is very difficult. To know what they have, and it's important to have that that's why I say your discussion with your doctor is really important. And if you have an autoimmune disorder, please talk to them. The one thing that I would tell someone on this call that if you're if you're under cancer therapy and you're going for radiation or chemotherapy, excuse me, chemotherapy, uh, do not take any antioxidants, none.
Excellent.
And the
Yes,
reason being that, and the reason I know that is that the cancer center here, a major cancer center, uh, I discussed this with them. They said, no, do not take anything with that because they said it could protect the cells they're trying to eradicate. So,
that's right. That's right.
just,
That's correct, David. That's excellent advice you're giving the team.
okay.
Excellent advice.
So just remember that rule of thumb. Beyond that, any other medications like I mean, I've seen tons of different medications, blood thinners, things like warfarin and all that. I don't know. I haven't seen anything that's going to be contraindicated, but at the same time, I don't want someone to get hurt and assume that they're always safe because they've they thought that they could take something. So please talk to your doctor just to be 100% safe. Okay? I'd rather that.
David. Thank you, David.
Okay? Are we good now?
Do we have
See?
any other questions?
No? Okay. So that's how yeah, what am I doing now? Okay. So we just discussed, things like Fountain of Life and how it really works. And when I was talking about microsilver, and I think microsilver is a real key product. And the reason, the thing is that we could talk a lot about that we have microsilver in it. And to some people, it might be important, but the reason why it works is even more important. It supports and soothes the skin. It is an incredible antimicrobial product, and this has been used since the days of Cyrus the King, where they used silver casks for their water to protect the people from dysentery, from bacterial infections, and kept the water pure. And it's been known for centuries that silver has this incredible property. So let's remember that we have something very powerful. Now this is medical grade silver that we're using. This is pure silver. And this is the silver, the same silver that's used in implant technology. So if you ever hear someone say, well, I don't know if it's safe, whatever, you can tell them that this is the same silver they're using in hip implants, knee implants, and dental implants. And they coat it with this microsilver to reduce hospital-acquired infections, which is a very costly thing in around the world. And if you're not familiar with the HAIs, hospital-acquired infections, are the result of being in the hospital, having a procedure, and the patient acquires an infection that falls upon the budget of the hospital to repair that. And that becomes very expensive. So that's why they started using microsilver technology in implants, because implants have a high infection rate. And so they're trying to reduce it, and they're using microsilver. The same microsilver we're using in sterling, in FERI Flawless, in our toothpaste, everything. Okay, so I want everyone to realize how powerful this is. Now, why is it powerful? It's powerful because it's number one, it's highly porous. I mean, it's got a very, very large surface area that cannot, and that large surface area is important because it can't be absorbed by the body, but the surface area is such that it emits in a moist environment silver ions. And what do silver ions do? It disrupts the transport mechanisms of bacteria and virus, and it kills it. It really eliminates it because it perishes under those conditions. And it's very safe that way. And so the other second question always is, well, if it works so effectively on the bacteria, how does it impact the natural flora of the skin? And we have to take a look at that. And that's one of the questions I had is, my gosh, like if it works that well, we got natural flora that's so important to our health, doesn't affect it. And I thought it can't be that smart. And it really isn't. It's just where it resides. Because it can't be absorbed by the skin or the mucosal layer of our mouths, whatever. Um, the microflora resides below that, so it can never reach that, and that's why it helps the microflora of our bodies without impacting it. And where the bad bacteria, or the bacteria that causes so many issues, is found on the surface of our skin or in our mouth. Now, when it's on our skin or in our mouth, the porosity is really important because it hooks into these areas. And so theoretically, it will last a long time. It will last as long as you need it to last until you wash it off. And so Microsoft has got this unique property of continuing to work over time. And they started doing tests on it. They found out how well it works on certain types of skin types. If we have atopic dermatitis, which is, or we have other issues like acne-prone skin. You can't say acne, we can say acne-prone skin. It does help reduce the bacteria load on it and improves the appearance of the skin. We use it in the FERI Flawless. When we started using this, we used it in the FERI Flawless Quad AG because we knew during the evenings when we're resting, it helps support the skin's processes during rest and recuperation. And it's really important for that to be done. And if during that period of time, it helps the restorative processes of our skin, that's what helps us make us look younger, believe it or not. And so that's why people who've used Fair Flawless have incredibly changed. I would say change looks, but I think their skin texture has improved immensely. It's highly moisturized. The lines and wrinkles have greatly reduced as a result of that. But you have to be consistent in this. Okay. I see a question just came up. I just want to do this really quickly. Is the vitamin 3? Yeah, the vitamin 3, no, you should not have to take extra vitamin. No, the vitamin D3 should be enough for your daily allowance. You don't have to supplement that any further. It's the sunshine vitamin. So yeah, it should be okay. We should have enough vitamin D3 in our diets. Okay. Using Divine. Sorry, I wasn't that clear. Anyways, so we started, and when we started going that direction, and with the Quad AG, it showed some marked changes in people's appearance, and it was incredible seeing some people that became uh, regular users of the product. They did see some incredible changes, incredible anti-aging benefits from the product. But we also started looking at other things, and one of the areas with toothpaste, can we, could we create a toothpaste that was fluoride free? And if anyone understands, it's going to be interesting. The United States is going to become very interesting. We're going to hear more about this in the next while with RFK Jr. Leading the helm, because he is very much into natural medicines and all these wonderful things. And he has already talked about fluoride and fluoride exposure. And we've been discussing this for a while. And this is not to scare people. This is just to bring people uh, some information so that they can make an informed decision. But fluoride exposure has led to things like skeletal fluorosis, which is the misshaping of your skeletal development. 40% of American teenagers have shown dental fluorosis, which is a staining of the teeth that's permanent. And that's not such a horrible thing, but the experts are really worried that if these children are showing dental fluorosis, are they going to have skeletal fluorosis in their later years? And they're not really sure. And they're worried about that because that can impact the healthcare system. They've also proven that an increase of fluoride and exposure leads to diabetes type 2. And so, and again, another blight on the healthcare system. But the thing that was really alarming and shocking, you're going to hear this from RFK Jr. in the next while, is that fluoride exposure has been proven to lower the IQs and neurological development of children. And mothers who were exposed to fluoride or children exposed to fluoride at a very young age have lower IQs and impacted neurological development. And we were aware of that. Uh, we talked about that a lot. And the thing is that when we started moving forward and developing the toothpaste, one of the questions we had is if we're gonna eliminate fluoride, well, we need something that's going to work. What is fluoride for? Well, fluoride is used to mineralize our teeth. It's natural, but it mineralizes our teeth. It hardens our teeth, and any dental professional will tell you that. That's why they do fluoride treatments in the office. This is why they support, using fluoride because they want your teeth's enamel to be hardened. Because the bacteria that is in our mouth excretes acids that causes tooth decay. And of course, our dental professionals support this, and rightly so. This is developed for that purpose. The only thing is that discovering that as people swallow fluoride, there are some serious health issues that are potential, and that's the thing. Do people swallow fluoride? I heard one dental professional saying that doesn't occur. Well, the thing is that 10,000 Americans each year are hospitalized for swallowing toothpaste. So the answer is, well, no, it does happen. It's not huge numbers, but it still does happen statistically. And we don't know how many children do that in little bits. So fluoride exposure is a concern. And so for us to move ahead and develop a toothpaste, question is, what can we use? Now, we started searching, and it brought us back to the microsilver. And the microsilver company, they got I don't know, like 30 or 40 PhDs working there. They said they had studied toothpaste using microsilver at the Erlangen Clinic, Erlangen University in Europe, and they found that periodontal disease, halitosis, plaque formation, all were reduced uh, using microsilver. And so, looking at the studies and feeling very confident in the studies that we saw, we decided to move forward with it, and that's why we created that. And the people who've been using it have successfully seen the dentist, and the dentists have been very pleased with the results. Why does it work? That's the other question: is why does this product work? Well, what's happening is, you know. The product works well because it is eliminating the bacteria that would otherwise excrete acids on the teeth. Okay, so it's really important for us to really see the impact of how microsilver can affect us now and this is over time because what's happening is the microsilver does embed itself in the mucosal layers of our mouth, and because it's a moist environment, it's constantly working, and it will eliminate the bacteria that leads to halitosis, plaque formation, and periodontal disease, and it's very effective that way, and that's why it's been very successful as a toothpaste, and now as a mouthwash and as a mouth spray, because again we're bringing in microsilver, and you can't see it. It's not going to affect anybody that way. You can't see it. It's not going to make your teeth glittery or anything, but you can. It will line our mouth. It will reduce the amount of uh, bacteria there. And then anyone who's had a toothache, you should try it because it's amazing how it does reduce that. I think it just kills the bacteria and reduces the inflammation in the mouth. And I had a toothache, I broke a tooth, and I've used our toothpaste, and it did work. That's anecdotally, so I don't have any studies on that, but I just discovered that how effective it really is. Okay, I'm just checking to see if there's any questions.
Now, David, we just answered Rosie Felix question. She's a guest with us, and
Okay.
we just spoke about the effectiveness of microsilver and how it will kill germs on application.
Okay.
And we want to switch your thought pattern on to Rosie's second question, which she's talking about the autoimmune with FOL lignoids play in boosting the autoimmune disease. So Rosie had another question as a little guest.
Okay.
Let's see if we
Well,
can satisfy her with an answer.
okay. What role does FOL ligands play in autoimmune diseases?
Mhm.
Well, autoimmune diseases, like in terms of autoimmune, it's a really broad subject because there's so many autoimmune disorders out there, but we've seen it time and time again how it affects us. Autoimmune diseases, it increases our oxidative stress in the body. Any autoimmune disease increases oxidative stress, and fountain of life reduces oxidative stress. And so people benefit from that. Is it going to cure an autoimmune disease? Absolutely not. It's not going to do that. But what it will do is reduce the oxidative stress that causes so many other issues with it. So yeah, it does help address it. Will it cure it? No. But will it help? Yes, in terms of some of the symptoms that they're seeing as a result of that autoimmune disease.
So Rosie, I hope David satisfied
And if you have an
inquiry.
autoimmune disease, yes, I would take Fountain of Life.
Mhm.
Absolutely, I would take it because we've seen it, how it helped. There's one young man that had alopecia, could not find anything, and he's well documented in our system that he could not find anything to help him. And he was depressed and he started using it, and guess what? His hair grew back. It's because it's just that the oxidative stress that his body was going through was reduced. And it sounds really simple on my end, and I apologize for making it that simple because I'm not, going through all the steps of describing exactly what happened, but it did help them. Okay.
David, let me reinforce what you just said. I have a person who bought FOL because of haloplasia, and I encouraged him to use a couple drops as well as taking it orally. And today, when I checked on him, he went for a haircut. So we had a good little chuckle. He says,
Oh,
wow, FOL is working.
yeah, no, it's nice to see
That's great.
because you know what? I think the product does work. I'm just looking up something right now, but yeah, the product works very effectively. Just that we don't want to generalize on autoimmune disease and say, well, this is why it works on everything, but you know, it does work very effectively on that. And so I think that we should, you know, if you got autoimmune disorder, I would consider using Fountain of Life. Uh, but you want to reduce the oxidative stress in your body. And that's what we were trying to do. Okay.
Right. So we also have, while you're looking into that question, that looking in for additional information for us, we have Naparon, also a
Mhm.
guest with us in Thailand. He's talking about, we'd like to talk about magnesium and how many menopausal women can divine be a substitute for magnesium. Let's hear your
Uh,
thoughts on that.
okay. Magnesium is something we can't produce, number one. Okay. So, you know, let's say this, we're not here to replace magnesium because we don't have a replacement for magnesium. Okay, so if magnesium is something that's recommended in something in your diet, it's like zinc. We don't produce zinc. We don't produce magnesium. And if we are devoid of that, that's what I'm trying to figure out exactly because I'm not an expert on magnesium, but it's required for energy production, oxidative phosphorylation, and glycolysis. Main benefit of magnesium is healthy muscles, nerves, bones, and blood sugar levels. Uh, Yeah, we could do that with Divine, of course, but if magnesium is an important part of your diet, then I would not try and substitute it with Divine. I would augment your diet with Divine, but I wouldn't substitute, I wouldn't take away something that's needed because we can't produce it. Okay?
David, look at the next question from Irania.
Hmm.
She's talking about radioactive iodine treatment
Yeah.
and her thyroid problem. And now she's taking FOL, about 4 bottles, and now only 10 drops a day. After taking thyroid hormone, she's thinking of stopping FOL as the blood test results does not show any improvement. How can I help explain to her, please? So this is Arania. She wants
Okay.
to hear your thoughts on that.
Question. I don't even understand. Like she's taking radioactive iodine treatment, which tells me that she has probably, does she have thyroid cancer? Is that why she's taking it?
So
So,
Arania, you have to give us more
see, I don't
information on
see,
that.
see for you're asking me to give you an answer for something. I don't even know what's wrong. But if it is, let me just do a quick look here. Radioactive. So I got therapy. Here it is. I just want to see what they're using it for. Oh, it's for hyperthyroidism and certain types of thyroid cancer. So that's what they're doing. So she might have thyroid cancer, and I'm going to assume thyroid cancer. I could be wrong, but as I said before, if you're going through thyroid, if you're, I'm sorry, if you're going through cancer therapy, do not take antioxidants because it's negating what they're trying to accomplish. Okay, so radioactive, if it's for hyperthyroidism, even you're negating what they're trying to accomplish. So you cannot be like what you're doing is you're counteracting what they're trying to do. Radiation is going to increase oxidative stress in the body, but that's on purpose. So what you're doing is you're neutralizing. I would tell her to stop using this, number one. Okay, stop
So
using it because
Irania is
because what
saying,
because what you're doing is you're undermining what the doctor is trying to accomplish. Like like the doctor is providing a therapy, and what you're doing is counter. acting the therapy because they're trying to increase it. Like obviously, radiation is going to increase oxidative stress, but they're trying to do that on purpose.
Mhm.
And so what you're doing is you're countering that. So you're eliminating the benefits of what they're doing. So no, I would stop that immediately. I would tell them to stop until they're through the radioactive iodine treatment.
So Arania is saying it's not cancer, it's hyperthyroidism. So that is why she's using it.
She said probably though.
Hmm. Hmm. So this is why
See,
she.
like that. See, that's not a definitive answer. And the reason I say that, in medicine, you can't. Well, they do all the time, but let's say probably. It doesn't mean it is definitively.
Right.
So the thing is when we come down to this, if they're doing radioactive therapy on anybody, stop using fountain of light. It's just a rule of thumb. It's a very easy rule of thumb. Just just stop taking it until it is okay. In the one-time treatment 2 years ago, hold it. Well, I can't answer this if you're adding in information as we move along. It's impossible to answer this if I'm learning about something different every time. Okay, like if I'm going to answer this question, I need to have all the information. Okay, because now you're saying this happened 2 years ago. So I still don't understand. It says blood tests did not show any improvements. So she had a one-time treatment 2 years ago. And how can I explain this to? Well, I don't think you can explain it because I don't think there's enough information here. The information is too sketchy. I would ask her to stop using it for now until you figure out exactly what is going on because there's too much non-information in there. Uh, but as far as taking 10 drops a day, I don't think 10 drops a day is enough. You should be taking 30. For the average person, you'd be taking 30 drops a day. But again, in this situation, when you're just getting pieces of information, I would say stop because you're not going to be able to help them. You can't help a person when they just give you bits and pieces of information as you move forward. It's impossible. There's not a doctor in the world that can answer a question like that if the landscape keeps changing in terms of what it is all about. So please, I would tell them to stop for a while. Okay, I would just tell them to stop for a while and see if there's any changes. And then if you're going to go back on it, give it a couple months and then start again and do it at 30 drops. But I do not know what else I can say at this point because there's not enough information for me to answer properly and fairly to you. Okay.
So can I ask, do we have any more questions at this time?
Sorry, I'm just trying to give you guys good answers, but I really do have to understand the situation properly and fully. For example, I had a woman tell me that they had a problem with Fairy Flawless, that it was reacting. I asked them if they were taking any medications, all this stuff, and they said no at that point. And I said, okay. And I suggested they stop using the product. I got a call 3 months later, and they said, well, their skin is still reacting. And I said to them, did you stop taking using Fairy Flawless? They said, yes, when you suggested 3 months ago. I said, okay, but why would you think it's still Fairy Flawless that was causing it if you haven't placed anything, you haven't been using it? Number one, they didn't have an explanation. Number two, they said, well, I'm taking all these meds. Do you think it could be that? So again, it's just that they didn't give me the full scope of things. So at the same time, they'll put blame on a product, and that's the easiest way of doing this. Okay. And so just remember that people are people, and they will give you an explanation that sometimes doesn't make any sense. Okay. And you have to be patient with people because their health is very important and it's very valuable to them, but sometimes they don't really understand exactly your line of questions, and sometimes it's hard to answer. In all fairness to them, I see this question on this line of cancer treatment. Someone who had breast cancer 5 years ago, despite being clean after the surgery and treatment, she's still on some maintenance treatment until the end of December.
20 hours.
In this case, fountain of life should only be introduced after the treatment stops and the doctor approves it. And the reason I say that because sometimes there might be some lingering impact of that, and they might need that time afterwards. So they might stop it on a Monday, may continue on a little while longer. There might be a latency effect, and you want to make sure that you are keeping that treatment going. But yeah, once it's done, it's done. And then you should be cleared to take Fountain of Life again. But just make sure that the doctor says it's safe. Okay.
Do we have any additional questions at this time?
Okay. Let's see. I have good. There's one. I've given 10 drops a day. Would that be enough to start for a very small 22-year-old young woman with severe allergies, which has breathing problems and clogged nose? Okay, when you have severe allergies, you're going to have elevated histamine levels and everything in the body. That's what causes that. The whole wonderful cascading effect of allergies. So I don't know if Found Whole Life is the right product to help with allergies because I have a lot of allergies. I don't think it impacts it that much, but I would try 30 drops a day. And it's not that I'm trying to push 30 drops, it's just that the studies have shown that 30 drops seem to be impactful. And that came out in 2018 with Biasiato's group. That it was very I think it was very important in terms of the study and how impactful it was, but they did not discuss. They looked at fatty deposits on the liver, cardiovascular disease. They looked at visceral fat. They looked at HDL, LDLs, um, diabetes type 2, and the impact thereof, insulin resistance, and they showed the positive impact. I've not seen a study on allergies, and I can't give you a clear explanation of that, but I would try, you know, I would try 30 drops to see if it makes a difference. And take that orally. I'm not, for people that say place it up your nose or in your eyes or in your ears, the answer is no, because we've never tested it that way, and I don't know if it's going to impact anything. So please don't do that. Okay.
Do we have any more questions? Because David has given us a lot of information here this evening. He has shared with us the proper guidelines under which we should be promoting our healthcare products. He has emphasized the value of our microsilver in our oral and skincare products. And we've definitely been empowered with a lot more information. So if at any point in time we are asked questions by our prospective clients or users, we are confident that the information that David has been sharing with us is going to give us a more professional approach to positioning the value that our products hold and to appreciate the value that they will bring in persons' lives going forward. So, I mean, we have a few more minutes left. If you all have any comments to share, please go ahead and share it for our guest. We hope your questions were answered and you feel a lot more comfortable with regards to the
You know,
positioning of the
yeah.
products.
Just remember, people are people, and when it comes to healthcare, it is a difficult. I'll tell you, this is why doctors are paid so much. And this is why they're so valuable because they know how to get to the root cause and they know how to ask the right questions to find out exactly what the problem is, and they go through what they call differential diagnosis. It is not easy. Okay,
Mhm.
it is not an easy task, and my hat's off to them when they do it. At the same time, you're almost in the same position when you're talking to a prospective client because you're going through, they're going to tell you all sorts of things and they're not going to make it easy for you. I've got this issue. Will it help me? And it's a very broad thing. So just remember, as I answer these things, and I apologize if I seem impatient because I'm not trying to be, but at the same time, they make it very difficult to treat patients, and I was treating patients for and it's a long story why I was doing it, but I was treating patients for a long time, and it was very difficult. And I was working with a senior surgeon on this, and he explained to me the challenges that he faced throughout his career, and he was right. It's very difficult to get to the final answer. So be patient with it and don't get discouraged. So I think don't get discouraged when a person says, "Well, I did this. I've been doing this. Will it work for me?" Oh, it didn't work. Well, it doesn't mean it didn't work. It means that maybe they didn't even take the product. So just be patient and understand that people are people and they give out the information that they want or they think they've given you. And so don't be too hard on yourselves because it is not an easy process. And that's why doctors are special people. Nurses are special people. They're very valuable because they've got the ability to uh, ask the right questions in the right mannerisms to get the answers they need to treat the patients. It's not straightforward. And so like I said, you're in the same situation when you bring in a healthcare product. Okay, always remember that you got a healthcare product, and they're going to ask you very similar questions like they're going to ask a doctor, and you might not have the answers, but they might not have the answers as to what you're really asking. And they might think one thing, but it might be completely erroneous. So just be patient and don't worry about it and don't get too upset. The worst thing you can do is ask them to stop for a while. That's the worst thing you can do. And you can be very, very proactive and say, look, I'm going to ask you to stop. I'm going to call you in a month. We're going to start again. And this is what we're going to do. Just put a plan of action together so that you haven't closed it. Just don't say, oh, just stop. It's no good. It doesn't mean that. Just say, we've got a plan of action. We want to do this. Or I'm going to introduce you to Divine. Or we're going to have a collagen product. Or, there's so many different ways you can approach it, but just don't leave it high and dry. People's health is important. Okay? Really important. And the best thing you can do is be consultative to them and just say, this is what we want to do. Like, we're going to ask you to stop, which is not a bad thing. We're going to see how you are. Let's monitor this. Let's create a baseline and see how you feel. And then we're going to add in 30 drops a day. Let's monitor that. So you got constant communication. And at the end of the day, you will help them. You will find something for them. Okay? Promise you.
David, we're getting very positive comments here. A lot of our guests
I
here,
hope
a
I
lot
helped
of
you.
colleagues, they are appreciating the information that you always share.
Like, your
It's
jobs are
always
hard.
valuable.
Your jobs are hard. It's really hard. And there's nothing like that, especially when you mention going to the healthcare arena. It is a hard
Yes.
thing to do. And
Mhm.
so, and my answers could be sometimes hard, but I'm also trying to give you the truth of the matter and how to best approach it. Well, how I find it the best approach. You might have a better way than me. And please do that. But I just want people to be successful and comfortable. And as you move forward, just understand that the worst thing you can do is overpromise, okay? And tell
Correct.
them something that's not true. And you can't go
Correct.
around saying certain things. But I wish you all the best of luck, and I thank you for allowing me to join you. Okay?
Thank you. Thank you, David. It's always a pleasure. We appreciate you. Every session that you share with us. Thank you very much for the information shared. It is certainly a guideline as to how we should approach the respect we should have for doctors, the respect we should have for persons taking certain medication and why it's important to have collaboration. You know, you speak with a doctor, you speak with a nurse, you advise the patient so they're not disappointed and their expectations doesn't rise way beyond reality. So thank you very much for the information and for the sharing the value our micro silver holds, the value in terms of protection, again, gram positive, gram negative, viruses and so, and again, it's placed in perspective. So thank you very, very much for the information. We want to thank you for joining us. Thank you for your time spent with us, and thank you for engaging in very active communication with our speaker. And we want to thank you very much for being here with us. So look forward to seeing you next time around. Pleasant evening, pleasant night, and we are making billions. So thank you. Thank you very much. Thank you very much for being here with us.